So 5 factors are there: egg, sperm, uterus, tubes, and line coordination. Now, when we talk about the things we can explain, these are the basic investigations. For example, we do a semen analysis, we do a ovulation monitoring. So 5 factors are there.
What unexplained infertility is?
So the name itself explains what it is actually. It is unexplained. This means that you have not found the reason of infertility as of now. Okay. So what happens? Let me start with this model. Okay. This model here. So here, this is the uterus. These are the tubes. This is the ovary, and this is the ovary. The egg is released from the ovary. The tube picks up the egg and then brings it gets fertilized by the sperm and brings it and implants in the uterus. So for a pregnancy to happen, we need 5 things. We need a good egg, we need a good tube, we need good endometrium lining, we need good sperm, and we need a perfect coordination between these 4. Okay, 5 factors are there: egg, sperm, uterus, tubes, and coordination. Now, when we talk about the things we can explain, these are the basic investigations. For example, we do a semen analysis, we do a ovulation monitoring. So 5 factors are there: egg, we do a follicle monitoring, we track the ovulation, we test the tubes, and we check the endometrium lining where the embryo has to implant. So these things are checked and they are found to be normal. If all the parameters individually are found normal, but still you are not getting pregnant after regular intercourse, it is unexplained infertility. The reason has not been found, but there has to be some reason why it is not happening.
Great. Just for information, could diet be also a contributing factor to unexplained infertility?
Yes, yes. So I told you 5 factors.
Yes.
Out of that, egg and sperm, they get mostly affected by the diet. By not only by diet, by your lifestyle, even by your thought process. If you're not thinking in the right direction, if you're just all the time stressed, there are some kind of hormones released in your body. And if you are, not sleeping well, not exercising, there is fat accumulation. All these things affect the quality of egg. All these things affect the quality of sperm. And sometimes they are the most important reason of unexplained infertility. When we do the ultrasound, we actually see the follicle, but we know nothing about the quality of egg. When the quality of egg can be checked only when we take the egg out and observe it under microscope. Right. So yes, lifestyle affects the quality of egg. And when we talk about the sperm, we talk about the count, we talk about the motility, we talk about the morphology. But again, the performance of the sperm, we cannot know till we do the ICSI and see how the sperm is fertilizing. And both these things are affected by the lifestyle, by the diet, by the exercise, by the nutrition, and the thought process.
So for our viewers' benefit, when we talk about infertility or subfertility, we are like talking about 40% male problem, 40% female problem, and 20% unexplained problem. And so unexplained infertility is that 20%.
Yes, yes.
So for our viewers' benefit, when we talk...
So I'll tell you what is actually unexplained.
Yes.
So again, we go back to this model.
Yes.
So we see here that when we do the count and motility and morphology, actually, let's talk about each of the parameters. Okay.
Okay.
Let's first talk about the count. I told you that we know about the count, we know about the motility, we know about the morphology, but we don't know about the DNA fragmentation in the sperm. Yes. And we also don't know about the performance of the sperm. So these 2 factors are unexplained in the sperm. Go to the second part, that is egg. So when we talk about the egg, we talk about polycystic ovaries, we talk about the number of eggs, we talk about AMH value, we talk about low ovarian reserve. But the most important thing we need to remember, every female is born with a fixed number of eggs. And out of these fixed number of eggs, every month, some eggs are taken and they are used. Whether you use them or you don't use them, they are taken out of the stock. So not only that, with time, the best are taken first. So if you have 400, the 10 best will be gone. 390, next best. 380, next best. So combining these 2 things, we say that with each passing time, the quality as well as the quantity both decline. Okay. We go to the second part, that is egg. So when we talk about the egg, we talk about polycystic ovaries, we talk about the tubes. The tubes are like this structure. They have 3 functions. They pick the egg, number 1. Number 2, they move like this. This movement helps in meeting the egg and sperm. And the third thing is that they have an internal environment where the embryo can grow for 5 days. Okay. It needs to be perfect environment so that embryo can grow for 5 days. So when we talk about tube, we only check that the dye is passed and the dye is coming at the other end. And we say that the tube is open. But what if the tube is like this? It is open, the dye is coming out, but it is not functional. So the tube may be open, but not functional. Okay. Then we talk about the tubes. The tubes are like this structure. They have three functions. They last, but not the least, the coordination between these three factors and the endometrium line. When we talk about the uterus, we again do it checking by three ways. So we check by ultrasound whether it is a trilaminar endometrium. Then we check the blood flow. Then we put a small camera inside the uterus and see the inside of the cavity. And last but not the least, we check the receptivity of the uterus. So these are the parameters we need to check. When we say unexplained infertility, there may be problem that the sperm is deposited here, but it is not able to move up. There may be a problem that the tube is open, but it is not able to catch the egg because it is stuck somewhere. There may be a problem that the inside environment of the tube is so bad that the embryo cannot grow inside. There may be a problem that the sperm is looking good, but it is not able to fertilize the egg. There may be problem in the quality of egg. There may be problem, maybe the egg is good, sperm is good, but together they are not forming a good embryo. The embryo is not of good quality. There might be some genetic issue in the embryo. And last, because of some septum or polyp or something, it is not getting implanted in the uterus. So all these factors we need to check when we talk about unexplained infertility.
I'm sure for a lot of couples, the unexplained infertility, as the time goes and the treatment goes on, gets explained. There are couples whose problem remain unexplained.
Yes, because we know, see, we come to know about the quality of egg.
Yes.
We actually put the sperm inside the egg, so fertilization happens. Then we know about the embryo, how it is forming, how it is developing. Then we check the inside of the uterine cavity. So we know there is no septum or nothing. And also, if there is a bad embryo or if there is something else, we can know about that also. So we need to understand that IVF is a process of diagnosis along with treatment. Not only we are treating the patient, not only we are giving them a hope and baby, we also trying to find out that which among these factors was a problem. Why the pregnancy was not happening till now.
We talked about infertile couple. What are the numbers we are looking at when we say unexplained fertility within India? I know on the round figure it's 20%, but according to the...
I think roughly 20% only.
Okay.
Yeah, it is all about 20% only.
Okay. So
I would...
Yes.
Sometimes it's a combined factor also. Both male and female have problems.
Yes.
And it is becoming very common nowadays. Very common.
So there are cases when the egg is good, the sperm is good, but together it's not good.
Yes, yes. See, like for example, this is a husband's genetic structure, and this is the female genetic structure. Now she has one recessive gene, and he also has one recessive gene. Now this is good. This is perfect. You know, both of them are good. The egg is also good. The sperm is also good. But when they together combine, there is a gap here. Okay. So this may or may not be viable with the life. So it may result in a negative or an unviable pregnancy or a miscarriage or a negative result.
Wow, that is so beautifully explained. As a gist, unexplained infertility are those reasons which you haven't stumbled upon, the solutions you haven't stumbled upon, or you haven't the diagnosis has not been done yet.
I would explain unexplained infertility as the cases where the routine investigations have not found any reason for infertility. Okay, so if the basic investigations have not found any problem, so that means that you need to go deeper. Suppose there is a car, everything is working, the steering is working, the wheel is working, everything is working, but the car is not moving. So what you need to do, you need to take it to the mechanic, and the mechanic will open the car and find out which part interaction is the problem. So that is what happens here. Individually, the factors may be correct, but somewhere down the line, the interaction is the problem, and ultimately the result is not there. So you need to take it to the doctor. The doctor will open everything and see where is the problem.
Right. I know that doctors hate talking about numbers, but when we talk about unexplained infertility, what are the success rate like after treatment?
So I'll tell you that, first of all, we need to remember that each case, each human being, each individual is different.
Yes.
So no two fingerprints are same. So
I know that doctors hate talking about numbers, but
I will tell you unexplained infertility sometimes we get result even with a simple IUI also. Because if it is a male factor, there were, there might be a problem with the count and motility. So that what we do is that we collect 2, 3 samples, we do a pooling of semen samples, and we put them together. So there might be some cervical factors, some antibodies present. That is why the sperm is not able to negotiate the cervical loss. And with this simple IUI, patients get pregnant. So I would say that there at least, if we say 100%, if say there are 100 cases of unexplained infertility, there will be a reason found in almost all at the end of it. Okay. Whether we are able to give them pregnancy or not depends upon lot many things. But I will tell you, unexplained infertility, sometimes we get result even with a simple IUI also. Because if it is, an example, if the problem is egg quality, if they are not able to improve, the solution might be donor egg. Or if there is some genetic issue, the solution might be getting a genetic testing done and finding a euploid embryo. So I will not talk about the success rate because it also depends upon lot many factors. But I can say that 99% of the times in unexplained infertility, we are able to at least find the reason that why this was not happening. And I consider that as a success for unexplained infertility, because now we know that what is the problem.
Yes.
For example, if the problem is egg quality, if they are not able to improve, the solution might
So
be.
what could be the top reasons of unexplained infertility?
So mostly it is
diet.
Yeah, the lifestyle and all. It is probably the egg quality. Then as I already explained the reasons, the egg quality could be the reason, the tubal factor could be the reason, the tubes are open but not functional. There could be performance of the sperm is not, once a sperm is attached to the egg wall, there is a cascade of enzymes that happens. There is an enzymatic reaction. Like say, suppose 100 enzymatic reactions are happening. And if only even one enzyme is absent, it will not be able to fertilize the sperm. It will not be able to fertilize the egg. So there could be problem in the quality of gametes. There could be tubal problems. There could be problem in the uterus. There could be problem in the implantation. There could be genetic issues. So we need to find out which one is ours.
Yes. So what could be the top reasons of unexplained infertility?
So mostly it is
diet.
I told you.
Yes.
Usually the solution lies in IVF. Why? Because IVF is a diagnostic process along with treatment. Okay. Not see, if the egg quality is the problem, we can exactly take the egg out and assess the quality of egg. We can know that whether this egg is good or not. We can either improve the lifestyle, change their habits, and then we may get the better egg, or the couple may decide to go for donor egg. Number one. Number two, if the genetic issue is there, then you can go for genetic testing and you can exactly find out the euploid embryo. If the tube is the problem, then you are actually bypassing the tube in IVF. If the ability of the sperm to fertilize the egg is the problem, then you are doing a ICSI. So you are solving that also. So multiple solutions are there. Many of the reasons are solved by doing IVF. Reasons I told you.
Yes.
Usually the solution lies in IVF. Why? Because IVF is a diagnostic process along with, yes, sometimes the patient, like for example, if I say the egg quality is a problem, I tell them that low ovarian reserve is there and the egg quality is not good and this egg is not able to give you an embryo. But the couple doesn't want to go for donor egg. They want to try with their own. So yes, in this case, there is a difference between diagnosing and treating.
Right.
However, on the other hand, if the tube is the problem, we are bypassing the tube. So the here diagnosing is equivalent to getting a baby.
Exactly. What's the advice that you would give to people who are seeking help for unexplained infertility?
So first of all, my most important advice to them is, you first of all, you assess yourself consciously. What exactly are you doing? How is your lifestyle? Are you sleeping well? Are you eating well? Are you exercising? Are you taking too much of toxic substances into your body? Are you taking too much of alcohol or smoking or drinking or anything else? First of all, this assessment should be there. Then the second step should be correction. Like whatever you are doing wrong, suppose you are sleeping late in the night, you are scrolling on the phone only, then make a conscious decision that I will correct this now. I will try to focus on improving my gametes. Now, one most important thing you need to remember is age plays a very important role in infertility. So if a couple is married for long and they're trying for long and they are slowly reaching towards 33, 34, 35, then don't waste time. Go and meet the doctor and take the next step, because we don't want you to reach a position where you cannot use your own gametes. Okay. But if you are young and you are like recently married, then my suggestion to you would be to stop thinking about it. Don't be obsessed. It's not a pizza that you want it now and it will deliver in 30 minutes. You need to work for it. Just relax, do some walk, yoga, exercise, meditation, eat healthy, and then just enjoy the act of having intercourse. Just enjoy the act, and then the pregnancy will happen. But that is only if you are young and you are not married for long, you are not trying for long. We say if it is less than 35 years, it should be 1 year waiting. If it is more than 35, it should be 6 months only. Second step should be correction. Like whatever you are doing wrong, suppose you are sleeping late in the night, you are scrolling on the phone only, then make a conscious decision that I will correct this.
Well, thank you, ma'am, so much. And we at Subak Health Tech are very indebted to you.
Thank you. And I'm very thankful to you for giving me this opportunity. Thank you so much. Pleasure talking to you.
Pleasure. Bye-bye.